Hi, I'm Janeane. You're listening to KUCI 88.9 FM in Irvine. And if you're watching this on YouTube, we are doing something different with COVID. We're doing it with video, which is great to connect with people from all over. And today I have Dr. Nolan Kagetsu. Did I pronounce that correctly?
Yes.
Okay, excellent. Joining me from New York City. Hi, welcome to the show.
Thank you. Thank you for inviting me.
Well, I was glad that Winnie's son introduced me to you. You have a lot of great insight into staying safe right now, things to do moving forward. Could you tell the listeners and the viewers what it is you do?
I'm a neuroradiologist, so physician that does diagnose. I tell people you don't want to be my patient because that means you have headaches or back pain and stuff like that. But I look at the scans of patients with those kinds of problems and help treat those kinds of problems. I also actually do procedures, and this whole mask issue is very interesting for me because for some of those procedures we wear masks to protect our patients, and this is very similar to why the public should wear masks. Some people will say, "Oh, you know, I'm tough, I don't need a mask," but you're actually protecting other people. And so it's just a way to we're all in this together. We all want to protect each other and wear a mask.
I noticed some of the nurses that are showing their protective gear, they're actually wearing a few masks.
Right. So because of the shortage, sometimes even my colleagues are wearing two masks. So in the hospital, they have a thing called the N95 mask, which before this whole COVID thing, you could just buy at a hardware store because they were used for dust protection. And so it's N95 because it filters out 95% of certain types of particles. And those people would use them for working in dusty environments or painting or whatever. And so they would wear those masks, and it turns out it's actually very good for protection against COVID. So they would wear those masks, and then they would put a surgical mask on top of it, because if something splashed, you could replace the cheaper surgical mask and then preserve the harder to find N95.
Very smart. Sometimes I see people with a mask like this, their nose hanging out, and I'm thinking,
right, the nose hanging out is that kind of defeats the purpose. Basically, when we speak or even breathe, there was that unfortunate incident you may have heard of where the choir had a practice and they were actually trying to socially distance themselves at 6 feet apart, but just by singing, they weren't coughing or anything, but just by singing, they managed to infect quite a few people, and people died, and it was horrible. So the bottom line is that the masks actually are probably most effective indoors, because if you just think, if there's no circulation, you don't want to put your droplets into the air, and you don't want other people's droplets in the air you're breathing. So the masks are good for indoors and probably to some extent outdoors, or you might as well wear them outdoors, because if you're outdoors, you're probably going indoors, and it just keeps you from touching your face, which is the other thing that you really don't want to be doing unless you've washed your hands.
Now, give me an idea what it's like in New York right now, because I know what I've read, and I know the rates are very high.
Yeah, it's just very disheartening to hear people saying, "Oh, the people you see on TV are actors, paid actors." I'm like, oh my gosh, that is so crazy. But Manhattan was not as hurt as badly as, for example, Queens. So Manhattan we're over our peak. Our hospital's peak was probably April 9th, but we're still all working from home and that sort of thing. And the peak is delayed from the first infections, and there's all these articles about why California did better than New York, but and so we're coming down off our peak slowly, and the concern now is that, well, people will say, "Oh, we're past the peak. Let's go back totally back to normal, and that would be a big problem. We really need to, when we go outside, we really need to still practice social distancing and mask wearing. Those are probably the biggest things anyone can possibly do, or biggest things that most people can do. And yeah, I think, you know, and you're just being a good citizen and helping us all.
Sure.
I like to say, you know, we're all in this together, so we can do our part. I'm not wearing a mask now because I'm inside.
I know.
Yeah, right?
Tell me how it is as far as like Central Park. Are people being smart, or are they still congregating?
You know, I haven't seen Central Park in a while.
Okay.
I think some are smarter than others. I mean, when I do go out on this, I can go for a walk. You know, we can go for a walk, and we in New York, it's harder to go for a walk without seeing people, but most of the people are wearing masks. It's
Good.
really, I don't know if it's a law, but it's the recommendation, and most people are doing that. Although there are some, sometimes people will see, you know, people totally disregarding these guidelines or recommendations and hanging out at bars. So there's always, I think they say if most of the people do it, then we'll be in better shape.
I found it interesting that you said Queens was hit harder than Manhattan. Why do you think that is?
Yes, I think, well, so a lot of so-called, it's almost a class thing in some ways. It's hit the lower middle income class jobs. Many of those jobs, they cannot work at home, so then they're traveling, and many of them travel by subway. Even though the subway is a super efficient way to transport people, it's horrible
Petri dish.
Yes, it's horrible for this condition. So essential workers, people that, and then, you know, some people don't have great sick time policy. If they don't work, they don't get paid. And
Sure.
so they're really forced to, and so yeah, it's a combination of things.
I understand. I mean, if I've got kids at home, I'm a single mom, and I need to put food on the table, I'm going to go to work.
Right, and I mean, they have zip codes. As you know, there's this whole topic of health disparities. So they say your zip code has more to do with your health than your genetic code.
That's
and
interesting.
It's true. So if you look at COVID by zip code, a lot of the poorer zip codes have been affected.
What can people do as far as going back to work? Some are going to continue to work remotely. Some are completely out of work. Millions of people, as you know, are out of work. But
Right.
for people that have to go back to work, what can they do to be safe?
Well, they can. It depends on how much privilege and power you have. But those who are the bosses, they should really do the right things and get the workers masks. If you have a store, you should demand that people that enter your store wear masks. I remember somebody saying they forced me to wear a mask. I'm going to boycott that store, and I'm thinking, good. You know, I wouldn't want to go into a store with no mask, and
Sure.
and so that would be good. So if you have a store, you know, have people wear masks and encourage people to wear masks and social distance, and yes, little by little. I've heard some services, you could argue, are more essential than others, and some people say, I really need that haircut. Other people say, you know what, I'm going to think twice before I do something like that. I've heard of some people actually are even doing haircuts outdoors, which probably is not a bad idea, because it's that whole thing about people in a closed space with no ventilation. It traps the droplets, and that's why we need to have good circulation.
Mm-hmm. What are your thoughts about smaller schools resuming and then maybe having classes outside at a social distance?
The thing about well, you know, people say, oh, this only affects the older older people, and that's why I think that Anthony Fauci was saying we have to be very careful before we are too enthusiastic about opening schools. We've heard of some very scary stories with children. I'm not a total expert, but I have heard probably what you may have heard. There's this entity called Kawasaki syndrome.
Yes, I was going to bring that up.
And there's an inflammatory disease similar to that reminds folks of Kawasaki syndrome. So, the kids are getting, there's a story about kids getting admitted to the ICU and just lucky to be alive. So it's certainly not the flu.
And what is going to happen come September, October, when the flu starts ramping up and we have COVID? Is that the second wave or more so?
It's hard to talk about a second wave, but certainly all these social distancing protocols, staying 6 feet apart and wearing masks should actually reduce the impact of any flu.
Good.
You could argue that, they have all those charts with the excess deaths from COVID. You could argue that there would be even more deaths from flu. This should be reducing the excess deaths from flu as well. That's what I'm saying.
Are the symptoms of flu sometimes a little similar to COVID?
Well, I guess to the extent, I'm actually have kind of beyond my realm of expertise, but just common sense. Some of the things you hear about coughing do overlap with flu.
Yes.
Some of the things are actually kind of interesting that, people report loss of smell as a symptom, and some of those are or COVID toes and that sort of thing. The other scary thing is that people seem to be sick and they're afraid to go to the hospital, and there's more people dying at home these days. And
I didn't know that.
That's another kind of scary thing, and hopefully if they do feel like they need to go to the hospital, they'll feel safe. Now that the hospitals are less overrun with COVID cases, hopefully those people will then go to the hospital and get care for their heart attack or whatever.
Sure. Do you have an opinion about beaches? Because here in California, a lot of people go to the beach. They're told that they can't sit. They can exercise. Some people do go in the water. I'm apprehensive.
Well, I guess, probably there are worse things, but to the extent people can be 6 feet away, I would be apprehensive as well. Just there's one thing to have a breeze, and the breeze will blow your viruses away, but then it might blow it to somebody else, right?
Nice.
And so they say when you're 6 feet apart walking, if you're 6 feet apart bicycling, if somebody exhales, all of a sudden you're into that other person's exhaled breath, and if you're not lucky,
Right.
So I would just be cautious. To me, the people that I've seen people that, go to these national parks and there's no one, you can't see anyone. That seems like a ideal way to spend some time in the outdoors. But
yes. Are there things you do to keep anxiety at bay? Because there's a lot of people that are very anxious. They watch the news a lot. I feel like you have to keep your mental health in check.
Right. It is a lot of stress. Through my hospital, at least at work, they offered me the so-called mindfulness-based stress reduction program. So I've actually found that
that's good.
Very useful. And I don't know how many folks listening meditate or do that sort of thing, but I think that is a good way to keep reduce stress. Right. It is tempting. You can just constantly look at your phone and just read the statistics and on and on and on. And you do have to take breaks. People do talk about a silver lining of this COVID thing. You're even though you're at home, you can kind of reflect what is important in your life, and what things should um, what things was I doing that I maybe don't have to do anymore. Um, so there, some people are
Reflecting a lot.
yes, reflecting a lot, and trying to see what should, and then even as a society, you can argue what things should we go back to, and should we use this as an opportunity to make positive changes, as opposed to some people just want to get back to the way we were.
Right.
In some ways, we should all think about ways to make things better.
I agree. I see images of like animals in nature surviving because we're not out there as much, or less pollution.
Right.
Um,
Right. It's reducing carbon dioxide emissions, but in perhaps in a not sustainable way. I heard that actually, right, in China, all their factories had shut down for a while, and that was a good thing for the environment.
Hold on one second. I hear a garbage truck. I'll just edit this out. Hold on. Let me just wait till it passes.
Okay. No, I actually didn't hear anything, but.
Oh, good. I know I have a USB mic, so I didn't want to pick it up. Hold on.
That's okay.
This is great. We'll just go a couple more minutes.
Sure.
It's almost gone. What do you say to people? A lot of people are so antsy, and I know if I look at some of the images, the videos of nurses, they're in the trenches. They're dealing with so much, holding someone's hand who's going to pass away, who can't see their family. What do you say to people that are so antsy to get out and get back to normal, the way things were?
Right. I mean, it's a real thing, but if you go outside, still practice social distancing and wearing a mask. It's not such a huge deal, and I think our governor put it very nicely. He was holding a mask up, and he says, if you wear a mask, it's showing respect to the healthcare essential workers, whether they're the nurses on holding the hands of dying COVID patients, or the people that have to can't work from home. The transit workers. There's a bunch of transit workers that died from COVID just because they're doing essential services.
They have no choice.
And
they have no choice. They have no choice.
People have no choice. So the people that are saying I have a right to do things, they don't have these jobs. It's almost a class thing. I demand a right to put your life at risk is not right.
Right.
So I don't know how it's very difficult having these conversations with some people. That how do you change someone's mind? But to the extent you can appeal to reason. Unfortunately, this whole thing has gotten so political that if you're on one party, and it's very sad that it's become much of this has become politicized. But
you're right.
It should be a bipartisan effort to save everyone else.
I agree. As you said, I think we have to take away the positive moments of this. I know a lot of people I'm hearing, well, they're baking and they're gardening and they're riding their bike for the first time, or their kids are learning to ride a bike for the first time. They're spending more quality time. They're trying not to be so work focused, especially working at home. You have to decide, this is when I'm going to take a break and I'm going to tune in and be present with my family.
Right.
It's a whole different mindset.
Right. Being present is a part of the mindfulness,
yes.
Right out of the mindfulness playbook. But
yes.
Yeah, to the extent we can do that.
That would be great. Well, I want to thank you so much for joining me. Where can people find out more about you?
Well, that's interesting. I'm on Twitter, NKagetsu. You can follow me on Twitter. My direct messages are open, so you can always send me a direct message. That's one way. And LinkedIn, and that sort of thing.
Let me spell your name. NOLAN KAGETSU.
Yes.
All right. Well,
Well,
stay well, and thank you so much. I've really enjoyed chatting with you.
thank you for this opportunity. Stay safe.
Thank you.
Bye now.
Bye-bye.